Good morning, students. Today we will learn about the placenta function and how it function into the for preparation of the fetal growth. Okay. So today we will learn that first we will include into the introduction portion of the placenta. Okay. So placenta is a fleshy structure. Okay. It's look like in a fleshy structure. It is developed from two surface. That is, one is a fetal surface and second one is a maternal side. Okay. So in fetal component, that is also known as a chorion frundosum, and maternal component is known as a decidua basalis. Okay. So this is the two sources of the placenta, that is we can also called as a two surface, that is fetal surface and one is a maternal surface. Okay. So in the upper uterine segment, the maternal surface is a situated. Okay. Next, that is placenta is connected with the fetus through the umbilical cord. Means maternal placenta is connected through the fetus, but the medium of the two structure is connected with the umbilical cord. Okay. So placenta supports the life of the embryo. Means placenta fulfills the nutritive values to the fetus throughout the 9 months of the pregnancy through umbilical cord. Okay, which help into the providing oxygen, food, and help into the removal of the waste product like CO2 and toxic material. So placenta fulfills the needs of the fetus and providing the nutritive values to the baby and removal product of the baby like CO2 and toxic material. So this is the introductory portion, how placenta looks and how it's structured. Okay. So in figure, this is the placenta. Okay. So this hole is the membrane of the placenta. Okay. And this is the placenta, and it connected with the umbilical cord to the baby, means this is the fetus. Okay. So it provides the nutritive values to the baby for growth and development throughout the 9 months and removal of the waste product. Okay. So this is the structure of the placenta. Next, how the development of placenta occurs. So the chorionic villi is formed from the finger-like projection of the trophoblastic layer after 3 weeks of the fertilization. Okay. So while the completion of the fertilization takes place, the chorionic villi formed like a finger-like structure for the projection and by the peristaltic movement into the trophoblastic layer. Okay. Next, that is the chorionic frundosum, that is part of the fetal side. Okay, part of the decidua in which the blood supply is a high. So the fetal side, the blood supply is a high compared to the maternal side. So after the 10 weeks of the fertilization, placenta starts its function. So while the completion of the 10 weeks after fertilization done, then placenta starts its function. In further, we will learn about the function of placenta also. Okay, between 12 to 20 weeks of the placenta weight maximum. So while the growth and development takes place into the fetus in embryo phase, then the placenta weight is high during the 12 to 20 weeks. Okay. Now we learn about the structure of placenta at a term. So how at a term placenta looks. At a term, placenta is a flat, round in a shape, round and oval in a shape. Okay. So placenta feels flat, okay, and round and oval in a shape. And it is like in a spongy and fleshy structure. So the structure of the placenta looks like a spongy, means smooth and fleshy. Okay. Then thick at a center and thin at each side, means at a edge it feel like a thin, and at a medium, means center level, it feels like a thick. Okay. Then color of the placenta is a reddish. Placenta is formed from outer layer of the blastocyst. We already learned into the development of the for development and fertilization, okay, in embryology unit. So we already learned in that blastocyst cell. So from blastocyst outer layer placenta is formed. Okay. Now average weight of the placenta is 500 gram, approximately 1 by 6 of the baby's weight. This is a approximately weight of the placenta, that is a 1 by 6 of the baby's weight. Placenta weight is a that. Okay. So 500 gram approximately weight of the placenta, and diameter that is a 15 to 20 centimeter. Okay. 2.5 meter. Normal value of volume of the placenta, that is 500 ml, and umbilical cord which is connected to the placenta and baby, connected medium of the placenta to fetus, and length of the umbilical cord, that is 20 inches. And placenta has a two surface, we already discussed, that is one is a fetal surface and another is a maternal surface. Okay, so how fetal surface look like? It is a smooth, shiny and transparent layer, and umbilical cord is attached into the center of the fetus. Okay, so this is about the fetal surface. And what is the maternal side? So it is dull red in color, and surface is distributed 15 to 30 cotyledons, means 30 lobes, 15 to 30 lobes are present into the maternal side, which is known as a cotyledons. Okay, which is separated by the sulci, means some septum like structure is between into the every lobes, which is known as a sulci. So differentiated one to another lobes. Okay, on the maternal surface, small calcified white intract is also observed, means some calcified intract also we saw into the maternal side. So this is about the maternal and fetal surface, placental surface. Okay, next, that is the structure of the placenta. So we already learned into the introductory portion that placenta has a two plates, that is chorionic plate and basal plate. Chorionic plate situated at the fetal side and basal plate situated at the maternal side. Okay, so what is in chorionic plate? So it is in the inner side and lie into the amniotic membrane, and umbilical cord is also attached onto the chorionic side because it is situated into the fetal side. Okay, and next, that is basal plate. It is situated on maternal side, and between these two plates space is known as the intervilli space. Okay, so the space between the basal side and chorionic plate known as the intervilli space, and in which stem villi with their branches are present, and maternal blood is also present in between space. Okay, so what consistency between the intervilli space, that is stem villi and branches are present, and maternal blood also situated between the intervilli space. Okay, so clear, this is the structure of the placenta. Next, what is amniotic membrane? Amniotic membrane is formed of single layer of the cubical epithelium, means it is formed by the cubical epithelium layer and loosely attached with the chorionic plate. So it is also attached with the chorionic plate and having no function in a placental formation. There is a no function of the amniotic membrane during the placental formation. Okay, next, that is what is the circulation through the placenta. So one fetoplacental circulation and another is a uteroplacental circulation, means maternal circulation. One circulation situated for the fetal side and another for the maternal. Okay, so what is the fetal circulation? We will learn, that is two umbilical arteries are carries impure blood from the fetus. So from the fetus, impurified blood are carried by the two umbilical arteries. Next, they enter into the chorionic plate and supplies each of 1 by 2 in the placenta. So what they do means chorionic plate enters into the two umbilical arteries enter into the chorionic plate and supply into each part of the placenta. Okay, so now artery are breakdown, means it break down into the branches. Okay, divided into the small arteries and branches and enter into the stem of chorionic villi, and then they further divided into primary, secondary and tertiary vessels, means continuing division of the arteries, which is known as a primary, secondary and tertiary vessels. And fetal blood flow are 400 ml per minute, means how much blood flow is into the fetal side, that is a 400 ml per minute, which mainly depends upon the fetal heart pumping action. So how the heart pumping action of the fetus, it depends on the blood flow. Okay, then blood gives the carbon dioxide to the placenta and absorb the oxygen and return through the umbilical cord through fetus. Okay, so by the fetus umbilical cord, the purify oxygen and blood carries and absorb the and removal of the CO2 and carbon dioxide to the placenta. So purification of the oxygen fetus takes place and removal of the CO2 give to the placenta. So this is the one side circulation, that is known as the feto-placental circulation. Next, that is the uteroplacental circulation, which is also known as the maternal circulation. So what mechanism included in that maternal circulation? That is intervilli space between two plates. Okay, we already learned that is between two chorionic plate and decidual plate, that is the one space known as the intervilli space. It is associated with the circulation of the maternal blood, which included side the maternal circulation, and the maternal blood is delivered to the placental bed of a decidua through the spiral arteries, means the branches of arteries are divided for the placental bed. Okay, take the maternal blood. So this is the uteroplacental circulation, which is also known as the maternal circulation. So this is the two types of the circulation, fetoplacental and uteroplacental. Okay, lastly, that is the function of the placenta. So what is the function of the placenta? First function of placenta, that is the respiration, means purification and exchange of the gases occurs through the placenta to the fetus. Okay, so that is the taking puring oxygen baby and waste material, that is the CO2 and toxic material removal. So exchange of a gases takes place due to the placenta. So respiration is the main function. Then nutrition, means proper nourishment and nutritive values from the placenta to the fetus. Okay, passing through the umbilical cord. So this is the important function of the nutrition. Then storage, means some important values like calcium. Okay, calcium, folic acid, phosphorus are taken by the fetus and absorbed into the fetus. This is the storage function. Then excretion, means waste product and removal are done into the placenta through the fetus. Okay, so that is excretory function. Then protection, means any kind of the serious infection and outer environment protected through the baby from the placenta. Okay, so through the maternal placenta, they protect to the baby from any kind of the infection. So that is the protection function. Next, that is the immunological, means purify immunity build up into the baby through the placenta. So that is protect from any kind of the serious illness and disease. So immunological function. And next, that is the endocrine, means important hormones and enzymes included into the fetus through the placenta for protection. Okay, so that is the endocrine. So this is all the function of the placenta, which protect the baby from the outer environment. Okay, so respiration, nutrition, storage, excretion, protection, immunological and endocrine. So this is the total 7 functions of the placenta, which help to the baby throughout the delivery and 9 months of the pregnancy. Okay, so this is about the placental topic. If you find any doubt, you may notify to me. Okay, thank you.